Um, Good evening. Today I want to talk about some problems that uh, the world faces, and also specifically it's an internal problem of also United States. We have seen that since President Obama, there has been a struggle that the United States is making to meet the expenditure for health. The health sector, every president is bringing new laws and regulations, but they are not able to manage the health sector properly. And why does it happen? We have to see, like, if we want to manage the health sector, if we want to give social security of health to all the citizens, then what should be done? How we can manage it? Two or three things strike my mind. First thing, what is the demand for health? It is universal, right? So it should be met with public expenditure, because health, wherever you see in the world, service is good. It is it is given by the government. So we can make the health sector cheap. That is, uh, the cost for health, if we can bring it down and give it by the government. How this can be done? First thing, medical service, doctors and nurses, people who are employed in the health sector, just make the supply too high. Whatever demand is there, it oversupply. If you oversupply, cost will come down. People will be ready to take low salaries. Doctors will be ready to take low salaries if you supply doctors in plentiful manner. So I was my brother's son, who is in USA. He is preparing for medical, and he is got to study for. He has already studied so many years, and he has to study for another 10 years to become a doctor. Now, if one person puts so much of effort for becoming a doctor, naturally he will require that much of salary, or without that he will not work, right? So, simplify how a doctor can be manufactured, and manufacture a doctor in plenty of number. So supply becomes high, whatever demand is there, that can be met, and cost can be brought down. Government can afford it. National costs for health will go down, and it can be given to all the citizens. That is one part, that is the service personnel. Second part is medicines. We have seen that because of intellectual property, IPR management, what we have seen is the cost of medicine initial years, it is very high. When anybody does research and development in the medical sector, they claim intellectual property rights, and because of that the cost of medicine goes up. So what should the government do? Government should undertake health research or medical research at its own cost. Research and development for medicine, it has to be undertaken by the government. It should be publicly funded, and whatever outcome of that, the medicines, that must be given to the people at a low cost. Okay, you can freely supply it also from the hospitals. So cost of medicine will go down. These are some of the methods by which we can intervene in the market. You see, the reason why US is not able to face this situation is because they rely too heavily on market, and market has failed. Market is not working in this particular case. It is not being able to satisfy whatever the requirement the people are having. So you don't have to respect the market. Create a public sector. Create a public sector where doctors will be manufactured, nurses will be manufactured, medicines will be produced, research and development for medicines can be produced, can be done by the public sector. Create a public sector around it, and whatever is the outcome, and definitely if you manage it properly, you can bring the health cost down. Second thing that I have seen is the education cost. The education in the United States is very costly, particularly higher education. It need not be. It need not be that much costly. Why should it be? You see, there are so many educated people, but you have to manage how the universities function. You have to manage how education is provided, so that plenty of intellectuals come and study, and there is oversupply of teachers or lecturers. You can export professors to other countries also. They will also bring in revenue. So manage the health education cost of education, cost of higher education in the country, so that the cost comes down, and that can be, because the government takes care only the school level education. So higher education, many students are getting dropped out because they cannot afford the higher education in the United States. So to make it affordable by investing in universities. Why should you privatize it? Get some government funded universities which are high quality, like Harvard, Stanford, like that quality, government funded universities, and make the higher education in United States not that much costly, at least cheap for its citizens, students. And those professors that you manufacture from there, whatever research and development they do, you can export it, because the world needs good education in every country. So export your teachers and lecturers. So you can manage it in such a way that higher education is also affordable in the United States. Healthcare is affordable in the United States. These are structural adjustment mechanisms that can be undertaken if you don't have that biased favoring of private sector, or your ideological roots in markets. United States is so biased by market forces that it doesn't do anything in the public sector. So definitely it is my suggestion that higher education and the medical cost should be brought down. For that, whatever public sector enterprises, institutions has to build up, to build those institutions and interfere in this economy and make structural reforms, so that health cost and higher education cost can be brought down in favor of general citizens. Thank you.